Today there was a symposium on mucosal protective agent, and I had a short introduction for the symposium. Today's topic was peptic ulcer, GERD, NSAID-induced small bowel injury. Helicobacter pylori infection is strongly related with the development of gastric cancer. At least 8,000 early gastric cancers are treated by ESD every year in Korea. This slide shows typical healing process of ESD-related ulcers. In about 20% of cases, ESD ulcer scars form a small, sometimes large, elevated nodular mass. It can be confused with tumor recurrences. The reason of the elevated type ulcer scar is unclear, but may be related with the quality of healing. Reflux esophagitis is so common, but the pathophysiology of GERD is not clearly defined. One possible mechanism is dilated intercellular space. Acid and pepsin can penetrate into the esophageal wall due to the dilated intercellular space. Mucosal protective agent may decrease the inflammation by reducing the intercellular space. NSAID can induce small bowel injuries. This case shows NSAID-induced small bowel ulcers detected by the small bowel capsule endoscopy. Over the last 2 decades, there has been a decreasing trend in the rate of hospitalization due to upper GI complications, in contrast with an increasing trend of lower GI complications. From the clinical point of view, we need to know that NSAID-induced enteropathy may be subclinical. The patient may have subtle symptoms, so the doctors should have high index of suspicion. The possible mechanisms for upper GI tract injury and the lower GI tract injury is different. Among them, change in the composition of intestinal microbiota and permeability-related enterohepatic circulation may be important for the lower GI tract. One interesting thing is that germ-free animals do not develop significant small intestinal damage following NSAID administration. This means that microbiome change and permeability should be important for NSAID-associated enteropathy. I'd like to announce that the next Seoul International Symposium on Helicobacter and upper GI diseases, in short CHOC, will be held in next March, Seoul, Korea. The symposium website is already opened, and I'd like to invite everyone who is interested in Helicobacter pylori infection and various upper GI tract diseases. Thank you very much for your attention.